There is a quickening excitement and anticipation in the air. Indeed, the people of Zambia are empowered. They now have a sense of hope and power. They can now exercise this power to decide which ward councillor, member of parliament, and presidential candidate they will work with to solve their numerous challenges, the main one being improved access to healthcare services. For a long time, healthcare was free in Zambia. Both the rich and the poor had equal access to healthcare services. However, with the reduction of budgetary allocation to the health sector, user fees were introduced in the early 90s in order to increase the revenue base. Their introduction, combined with severe spending cuts for health, was severely devastating. The worst hit was the rural population. Rural dwellers find it very difficult to raise even small amounts of money to pay for health care.
So tulephera ambulance akati ambulance ali ambulance itola abantu abamimba. So ngati uliye ndrama basi ukufa kumuzi nkhale basi ukufa. Ndrama uliye tulete kuchana ku general hospital. So tifuna kuti pamene apa nasi nkhale general nasi.
More importantly, the majority of people stopped using the health services. Household surveys in 2002 showed that across the country, about a quarter of the patients were turned away from health facilities because they could not afford even modest fees. Almost 1 in 4 patients, given a prescription, could not afford to buy the medicines. Providing only 4% of the total health budget, user fees failed in their objective to raise the needed additional income. In 2006, the entire nation breathed a sigh of relief when healthcare was made free for all patients in rural districts. This decision was warmly welcomed by many Zambians and was internationally acclaimed. It was believed that this would be the first step in an effort to roll out free care to all Zambians and achieve universal access to health care. The immediate impact of the reform was drastic. There was an average 40% increase in the use of health services. The policy was right. User fees did block access to health care for Zambians. Unfortunately, the positive impact has been patchy and not sustained. Several factors, including poor and uneven implementation of the process, such as the neglect of health workers and medicines, a drop in investment, and serious problems of corruption and lack of transparency are to blame. This means that many vulnerable people are still being forced to pay for health care, a demand which they cannot afford. Therefore, Oxfam, through Civil Society Health Forum, came up with the initiative to support the Vote Health for All campaign.
Basically, one of the major reasons why Oxfam supports civil society in engaging communities and the government is because we have a rights-based approach where we try to ensure that communities are involved in the governance of the country. They are involved in the issues that affect them within the communities, and particularly health, because as you might be aware, health is an issue that affects everybody.
Panofu aboneli tugomba tulikutoto kwe bati ino tulikwete ompundo wakwe bati kuti twaikala pamona abantu abo ukulabire tukumyafu ebo pamyewe sheso so nangati tulikulabira pali health mwabona tifire kumya kuli kumusebo nangati fimbi efe tufuiri okuikala kwe bati tulikulanshanya ne bakwaswa abo kwe bati tuleikala shani kuno kulufwa nyama nangu konsoko tulikuya.
The Vote Health for All campaign was launched in August 2011 as a means of bridging the gap between political leaders and the voting public to encourage interaction and learning on health issues in their respective constituencies.
Kodinga siwazalowa mboma ndiye kuti uyu umoyo tizachita bwanji sitizafa.
Nde kushakuta kaifile mulemonekera kuchitashonzi. Baadaye mukulawe kuzinge fimbi. Bantu ngamwapoka fetuka misale limbi mkakusaka and then kunota mwakala kwera ati mumuone ufifo ili so mose mkakukira fekurusaka kula kwine maleta mwakakwere poku.
Tifuno sponsor kuti kodi nkani ya mankhwala pakuti ngati timvera kuti akabwera sata kukabwera chani kulibe mankhwala mayera visi kodi vanthu amene adwala AIDS azambo pita kuti ukatenga mankhwala.
The Vote Health campaign was as a result of the decision by civil society to engage elected officials during the 2011 tripartite election in health issues and to make health as a major issue within the election campaign. And given the situation in Zambia where our indicators are not that good, we felt that it was important that the communities themselves were involved in engaging their various aspiring candidates during the election to come out and present to them their manifestos, and to educate the communities on what they felt was important in their health manifestos, and the communities again to feed back to the politicians what they felt were the important issues within the communities.
The distance from the rural health centers to the only big hospital, that is Sorens General Hospital, the distance is very big. So most of our mothers die on the way.
Kwa lukataza olukwanu kimatuko aboswanenge malaria ko pamwatoho diarrhea na musururo mane ni AIDS ya lukataza mawo diarona kapa kiniti ni chole kwa zero babulezi sichabasamule musekuli aba kutachwana lona lwalumerana nize baza maera ni bayo lukupera kwa muso kuli balwekereza kwa tupatera nyana ni tumesha.
There is no need of having a clinic like the one which is in Funda, which has no window panes, which has no beds, which has no workers. Why do we call it a clinic?
The aspiring candidates were required to sign a social contract in form of a pledge card, committing themselves to work towards improving the health situation of their constituencies.
I pledge to 1. Ensure that government commits to increase the health budget to at least 15% in accordance with its commitment to Abuja Declaration, with greater transparency and accountability in planning and in spending.
It has been over a year after the euphoria of electing a new government. The Patriotic Front, under the leadership of His Excellency, Mr. Michael Chilufya-Sata, was voted into power. Indeed, expectations and hopes are high, as the nation is watching and waiting for the leaders to fulfill their campaign promises to transform Zambia, especially the provision of quality healthcare services. The people of Zambia, through the Civil Society Health Forum, are still demanding for equitable and improved access to healthcare services.
As an organization and as the forum, we are just looking for more resources so that we can sensitize as many people as possible, especially on the upcoming constitution, because this is where it will matter. If we don't have health issues embedded in our constitution, then we shall continue crying for shoddy works as far as health is concerned. So for us, as the Health Forum, it presents a very good opportunity, so much so that we can see what is contained in the constitution, because the right to health should be enshrined in the constitution. And I'm sure minded Zambians are not going to oppose this particular clause, because everyone wants to be healthy.
The people of Zambia are asking President Michael Sata, cabinet ministers, members of parliament, chiefs, councillors, mayors, permanent secretaries and all policy makers to pledge to be part of a future where every Zambian has access to good health care.